I was in shock. I was literally in shock with everything that was going on. It was very abnormal. He was having, at the most, 27 seizures a day. That's when everything just turned for the worse. I couldn't sleep at all. It broke my heart. The first thing that goes through your mind is, am I going to lose my child? My name is Cynthia Wojtaski, and my son is a CommuniCare patient. The day Edward was born, everything was going well. Healthy, big boy, 8 pounds, 13 ounces. When we got home, Grandma and Grandpa were coming to visit. My mom noticed that he was crying quite a bit, and I just thought he was just colicky. So we took him back for a checkup, and shortly after that, a EMS team came in through the lobby. The pediatrician called us shortly after that and asked us if we had noticed any problems with Edward. He thought maybe it would be best if we did an EEG. We found out that it was very abnormal. He just kept on having seizures. So he was having, at the most, 27 seizures a day. One of the doctors and a nurse come in and explained to me, your child's been diagnosed with infantile spasms. And I'm like, okay. But they look shocked because they're thinking, do you understand what we're telling you? And I said, yes, I understand. You have something to help my child with treatment. But do you understand he's going to be probably in a wheelchair the rest of his life? He's going to have several problems, be developmentally delayed. And yes, I understood that, but my child was going to live. My husband's contract ran out in Florida, so we ended up moving back to Texas. And I've met Dr. Velasquez and have just seen how incredible she is. I just watched her, observed her, and she was just so bubbly and so happy and always had a good attitude. And I thought, well, I want my son to be able to have that experience when he comes into the doctor. In my experience with CommuniCare, everyone is very friendly. CommuniCare is so much more than just a everyday clinic. It's something that I'm so grateful is out there and that I was able to receive just such excellent care. Everyone is so into helping the community. I think CommuniCare has a lot to offer patients.
I'm Dr. Martha Medrano. I'm the Chief of Clinical Affairs here at CommuniCare. CommuniCare Health Services is an interprofessional team of providers. We have physicians, we have nurse practitioners, we have physician's assistants who are able to help patients with their primary care needs. We are able to provide them laboratory services, pharmacy services, ophthalmology services, to be able to fully take care of their entire needs. It's a one-stop shopping concept to where the entire patient, entire families are taken care of.
All I can say is thank you, CommuniCare.
I am Dr. Carly Tovar. I'm a dentist at CommuniCare Health Centers.
I'm Martha Tovar, and I'm Carly's mother. In the early 80s, my husband had been laid off from his work. No severance pay, no any type of benefits. Everything was cut off. It created anxiety. I mean, at that point, we already had 3 children, all very young.
I did get very sick as a young child with scarlet fever.
You have to do what is necessary to survive. I was very familiar with services offered to the community. She was able to get some outstanding care.
Growing up, my mother did make volunteer work and church, and just being involved very important. I went to dental school and returned back to San Antonio, and just always giving back, always volunteering, always being involved is something that's always been important. And when I found out about CommuniCare, and then finding out from my mother that that was also a place that we had received care from almost 3 decades ago, it was really neat to see how things go full circle.
Addressing health disparities is CommuniCare's day-to-day business. It's the fabric of what we do. We're located on the west side of San Antonio. We're located in the neighborhood of the east side. We're located in the rural areas of Hays County and Kyle. A large number of our support staff live in the neighborhoods, so they fully understand the issues around diversity, the issues around poverty.
My name is Paul Nguyen. I'm the President and CEO of CommuniCare Health Center. The mission of CommuniCare Health Center is to deliver comprehensive, quality, and affordable healthcare service with the goal of achieving optimal health in the communities that we serve. Our vision is to be the primary healthcare system of choice. When the family comes to our facility, they get medical, dental, behavioral health, podiatry, vision care, everything in one place. I think what makes it stand out is the people, and we're very big on service excellence.
Just the feeling you get from the people that work here, from the patients that are here, you just felt the love, you felt the desire to just help and grow.
And a lot of our patients end up to be staff of ours as well, so we are a mirror image of the community.
What excites me about CommuniCare is the people I work with. It's the population I want to serve.
I don't want to be just another clinic where people come to get their care. I want them to come in and get a great experience.